Alright, good day everyone, and welcome to the next part of our discussion on the nursing process. We have critical thinking and nursing diagnosis. Okay. Nursing has a similar set of diagnostic language which are different from that of the medical diagnosis performed by the physician. Nursing diagnosis, as the second phase in the nursing process, classifies your client's health problems within the domain of nursing. These are particular problems that a nurse can treat and manage, and it describes your client's actual or potential response to a health problem. Actual meaning they are already existing. Potential meaning you would want to prevent the possibility or the risk of the patient to have a particular health problem. Okay. Now, to review the different goals and activities involved in the next phase, which is your nursing diagnosis. So primarily the goal of this phase is to identify problems that can be prevented or resolved. Okay? Identify your client's strength because this is your starting point. Okay? Know what are the things that your client can do and cannot do. Okay? And at the end, of course, you will be able to develop a list of nursing and collaborative problems. So when we say nursing problems, these are problems that a nurse can provide interventions to. Okay? When we say naman collaborative problems, it requires the help of the different members of the healthcare team. Okay, so what are the activities involved in this phase? Of course, after being able to collect the data from the first phase, we now can analyze them and synthesize them. Okay, determine your client's strengths, risks, and problems. And of course, at the end, you can be able to write your nursing diagnosis. Okay. So after gathering the necessary data from your client as an output of the first phase of the nursing process, now you are faced with a lot of cues. No? You will become very much overwhelmed with a lot of cues and of course your inferences from these cues. So what are those two? No? Cues and inferences. So let us write an example so that we can basically understand each. Okay. So you have here a family member, for example, who is lying in bed, holding her stomach area while squeezing her eyes shut. Okay? She can be having pain. Maybe it could be because of an injury brought about by maybe a surgery or a chemical reaction of the stomach lining to an ingested substance, maybe because maybe she was able to eat, she had eaten something that's bad. Okay, so this part here are your objective and subjective data. Okay, these are your cues. And your interpretation or conclusion after analyzing these cues are your inferences. Okay? So cues now, your assessment data from your first phase, the objective and subjective data will now be called as your cues. It tells you something. Okay? And that something is your inferences. Okay? This is your maybe hypothesis, your assumed answer to the problem of your client. What is the problem of my client? Okay? Based on my cues. Okay? So those are your inferences. Now, so let's try to work on this example. So to give you definite and concrete examples of cues and inferences. I have here, number 1, the client complains of diarrhea for 5 days. She has hyperactive bowel sounds, okay, abdominal cramping, and has lost 3 pounds over the last 5 days. So hyperactive bowel sounds, you can be able to assess this if you use your stethoscope and they place it on the epigastric area or across all the regions on your abdomen, okay? And then abdominal cramps, no? Pain at the stomach area. Okay, now, what could be your possible inference if you are given with these cues? Okay, so for a prolonged period of time, the client is already having diarrhea. So it could be possible that the client now has dehydration if the diarrhea hasn't been able to stop or is persistently happening over the last 5 days, as another evidence tell you that the client was able to lose already 3 pounds. Okay? So it could be possible because of maybe dehydration, or maybe the client is now having imbalanced nutrition. Okay? Because he's already having weight loss. Okay. So this could be my cue, my inferences from these cues. Another example, abdominal discomfort. The client had been in the hospital for the past 3 days. The vital signs include BP 100/60, 36/7 for the temperature, 0.7 for the temperature, respiratory rate 13, your pulse rate 63, that is monitored every 2 hours, has dark circles around the eye, and frequently yawns. Okay, so aside from the fact that the patient has pain, abdominal discomfort, okay, the vital signs now are starting to decrease. Okay, and these vital signs are monitored every 2 hours. So even if your shift is the time that your patient is asleep, you need to go to your client every 2 hours. So that would mean you would need to wake the client up in order for you to take the vital signs. Okay? Or maybe it wasn't intentional that you were able to wake the client up, but then again, the mere fact of you having to enter the door and take my vital signs every 2 hours, okay? So definitely it may cause sleep disturbances to your patient. And it is evident that the client is already having sleep disturbances. Why? Because he's already having dark circles around his eye, and the client already is frequently yawning. Okay. So these are now my inferences from the cues that I was able to gather. Okay. Now, critical thinking is also involved in this next phase, which is the diagnosis phase. It will be very helpful if you enumerate all your problematic cues found in your assessment data, and upon enumerating them, you need to compare these cues with a standard or the norm. Okay, so considering what is normal, or what are the things that you can normally observe to a client with this particular age, or to a client with this particular condition. Okay, so you need to compare your cues with the set standards, or what is normal, or what is expected. Okay, now, to give an example, say we have a 6-year-old child. Let's name her Sarah. Okay, Sarah's mother comes to Dr. Juan's clinic and is describing Sarah based on her usual observation on her child. Okay, so the mother said, my child has difficulty in expressing her ideas clearly. Like when she needs to pee, she would say, Mommy, pee, pee, pee. Okay. She does not behave in front of a lot of people. Oftentimes, she would throw a tantrum if we are in a big family gathering as verbalized by the mother. Okay, so these are your cues. Okay, now, when we say we compare our cues with a set of standard, what are the things that you normally observe to a child who is also a 6-year-old? Okay, a 6-year-old should be able to clearly and fluently speak using even more complex sentences than 2 or 3 words to express her thoughts. Okay, and a 6-year-old child begins to understand and follow social rules and norms. Okay, so like when you tell to your kid, okay, we would be visiting grandmother and you would be able to see your cousins, all your cousins there, oh, you need to behave. Okay, so if you tell to your kid that this is the expected behavior of your kid when you are in a social gathering and the client or the kid is still throwing tantrums and not being able to absorb that she needs to behave properly, then maybe something is wrong. Okay? So it is important to remember that every individual, yes, develops at their own pace, and some occasional differences in development are normal. However, if you notice persistent, okay, or significant delays across multiple areas of development, okay, that may interfere with your child's daily functioning or well-being, then consultation should be sought already. Okay, like in the case of this, Sarah, okay, the first cue talks about or discusses about the language, okay, component of the development of the kid. Okay, and the other one here is about social, personal, and social interaction development aspect of the kid. Okay, so this is now no longer concentrated with one, okay, areas of development. Now, so these are your standards or your norms that you usually observe to a 6-year-old kid. Another example, say a 14-year-old child or maybe a 14-year-old teenager. Okay? So the parent complains, my teen suddenly doesn't want to go out of her room for almost 3 days already. Okay? So what's normal among teenagers? You can observe deepening friendships and forming close peer relationship to a point that they don't even want to be, or they would even want to spend more time with their friends than their family. Okay? And usually you can observe in their behavior, they would want greater independence from their parents or maybe their guardians, caregivers, coupled with a growing need for autonomy. Okay, at times teenagers would want to, like, say, go out with their friends on their own. Okay, but then again, the problem is, or the cues that were given to you is that the kid doesn't want to go out. Okay, so this cue may mean that there maybe something is wrong about the child or this girl or this teenager, considering what is normal among adolescents, no, who usually like to be with their friends, their peers, rather than being stuck in their room for 3 consecutive days. So you should, or you may be able to entertain the thought that maybe there's something wrong. Okay. Another example. Okay, we have here a male who stands 5 feet 3 inches tall, weighing 245 pounds. Okay, so these are your cues. Considering, let us take a look what is normal or what is expected to a male who is 5 feet 3 inches tall. What should be your ideal weight? Okay, so let's take a look at the BMI chart. okay, which tells you what is the normal weight if you had this or if you have this particular height. Okay, so it mentioned that the client stands 5 feet 3 inches tall. So this is at this line or this area. Okay, and weighs 245 pounds. So where is 245 pounds here? Okay, so if this is your point of point where the x and the y axis meets, so it shows that it falls on the blocks which are colored red. And what does colored red mean? The patient is morbidly obese compared to what should be the normal weight of a 5 feet 3 inches tall, should be around 120, 130 to up until 140 pounds. Okay, so you can see that this is a deviation from what is normal. Okay, now by comparing cues against standards and norms, you begin to see that there is something wrong with maybe a particular behavior, the health status, or the physical attributes of your client. Then you may proceed with clustering. Okay, clustering your cues. This is done by grouping your assessment data according to a particular problem. Okay, so let us have an example of clustering your cues. Say we have here the vital signs of your patient. Okay, and then you have a temperature 38.9, 110 pulse, 32 respiration, and 140/90 blood pressure. Okay, the client is having excessive sweat. His skin is very warm to touch. Looking at his face, you notice facial grimace and tears rolling down his cheek. When asked to rate his pain, he said siguro 9/10 ito. He even has dark circles around his eyes and complains to you, hindi ako pinatutulog ng sakit ng tiyan kong ito. So upon reading the case of your client, okay, so you may be able to look at the different cues that were given to you from the case scenario. Okay? Since your vital signs are all increased, okay, we can get them as our supporting data. Now, the patient is having excessive sweating and his skin is very warm to touch. Collectively, when we look at these cues, it tells you that your patient is having hyperthermia, or in short, fever. Okay, so that's your first client problem. Next, you have, should we still include the vital signs? Yes, because our next thing that we can see as another problem is, aside from the altered vital signs, you have excessive sweating. You notice facial grimace. Okay? You notice that the client is already crying and rate his pain as a 9/10. These are all evidences that your client, yes, is having pain. Okay. And another one, you have dark circles around his eye, supports the complaint, the verbalization of your patient that he is saying, hindi ako pinatutulog ng sakit ng tiyan ko na ito. Okay? Proving that your patient has already having sleep disturbances. Okay. So from the scenario, okay, upon clustering your cues, you were able to deduce that your patient has 3 nursing problems. Okay. So after which, at this point, you can now see a very clear picture of every problem that your client has. You are now ready to write your nursing diagnosis. Okay? But before we can do that, let us consider the different types and components of your nursing diagnosis. To start with, the different types of diagnosis. Okay, number one, as we had mentioned, the existing problem at the time that you were able to assess, okay, the signs and symptoms that you were able to see tells you that there is an actual problem existing at the moment. Okay? An example, ineffective airway clearance related to presence of tracheobronchial secretions as manifested by weak cough. Okay. Airway refers to the daanan ng hangin. Clearance meaning, okay, there is something that is blocking, okay, the airway. And it is, or it can be found on the tracheobronchial area. And what is it that you can find there? You have secretions. Okay, so the secretions is blocking the airway. Hence, no, the client is having difficulty. Okay, this secretions or the airway clearance is supported by a sign or a symptom that you were able to see to your client as having weak cough. Okay, so this is now your nursing diagnosis as an actual diagnosis. Next, you have risk diagnosis. Risk diagnosis, here, the problem is not yet existing, but there are presence of risk factors, okay, making a patient or a client prone to have a certain nursing problem. Example, risk for infection related to, okay, so what is the source of the risk? Is the presence of surgical incision, because there is already a break in the continuity of the skin. Where is the surgical incision located? At the epigastric area. Okay? What causes the surgical incision? Okay? The client had a cesarean section delivery. So it makes the client at risk for infection. That's why we would want to prevent the occurrence of this problem. That's why we are making a nursing care plan aimed to prevent the occurrence of infection. Okay. Next, you have wellness diagnosis. Okay. Wellness refers to the readiness for a patient to a particular task. Okay. Say for example, these are usually your nursing diagnosis if a patient can now go home from confinement, okay, or maybe has already overcome the grieving process, okay. So like say for example, you have here readiness for enhanced family coping, okay. So these are your wellness diagnosis. Another one, you have possible diagnosis. Okay? So how does it differ from risk diagnosis? Okay? Possible diagnosis, evidences, okay, about a particular problem is incomplete or unclear and requires that you, okay, obtain additional data or additional assessment to either support the possibility of having this or to refute or dismiss the idea that there is a possibility that the client can have this particular problem. And one example could be possible social isolation. So these are your possible diagnosis. And lastly, you have syndrome diagnosis. syndrome diagnosis. Okay, this is a cluster of other diagnosis, meaning you don't only have one nursing diagnosis but a composite of nursing diagnosis. Example, you have risk for disuse syndrome. Okay, so these are your types of nursing diagnosis. Okay, now let us proceed with the different components of your nursing diagnosis. So discussing them can help you write your nursing diagnosis properly. Okay, so we have here one area, and one area. You have here the basic three-part statement. Okay, so the basic three-part statement is composed of problem plus the etiology plus the signs and symptoms. So meaning you would need to write the problem first, or your diagnostic label. So we'll discuss them one by one later. Then you have your etiology, or the related or the risk factor present on your patient, and the manifestation or the signs and symptoms of the problem. Okay, we call this the defining characteristics. Okay, how are you able to say that this is the diagnosis of your patient? Because my client has a triad of signs and symptoms of this particular nursing diagnosis. Okay? At most, you need to write at least 3 defining characteristics of this particular diagnostic label. Okay. Now, so that is your basic 3-part statement. Next, you have your basic 2-part statement. Okay. We have the problem plus the etiology. Okay. So usually, your risk diagnosis is written using the basic 2-part statement. Okay. And next, you have your 1-part statement. Okay. 1-part statement. This can be an example of your nursing diagnosis written using the 1-part statement is your possible diagnosis and your wellness diagnosis and your syndrome diagnosis. Okay, so this is your 1-part statement which only discuss or mentions the diagnostic label. Okay. Now, let us discuss each part of your nursing diagnosis one by one. To start with the first part, letter P, okay, your problem or your diagnostic label. So we call them diagnostic label. Okay. This describes the client's health problem or response to a particular stimulus. Okay. So this is your patient's response to a medical diagnosis. Okay. So the North American Nursing Diagnosis Association, International, or your NANDA, published a classification system of all diagnostic label. Okay? So they were able to develop the taxonomy of nursing diagnostic terminology for general use of a professional nurse and that of the student nurse. Okay. So this is your NANDA Nursing Diagnosis Taxonomy. Okay, so this is a classification of all your diagnostic label. Okay, so will help you in making your nursing diagnosis and your care plan as a whole. If you would take a look at your nurse's packet guide, the back part of it, the last few pages, the last 2 pages, is the approved NANDA Nursing Diagnostic Lists 2021 to 2023. Okay, so meaning this is, or that part on your nurse's packet guide is the most updated listing of all the nursing diagnosis that there is readily available. Okay, now, so in 2002, this taxonomy 2, Okay, so this taxonomy 2 was adopted, which was based on the functional health pattern assessment framework by Dr. Mary Joy Gordon. Okay, so this taxonomy 2 has 3 levels. The first part, the blue part, are your domains. We have 13 of them: health promotion, nutrition, elimination, activity risk, perception cognition, self-perception, role relationship, sexuality, coping stress tolerance, life principles, safety and protection, comfort and growth and development. So these are your 13 domains. Okay? So we said this taxonomy 2 has 3 levels. So the first level is the blue part, which are your domains. Okay? Then you have the next part, which are your classes. Okay? All these purple ones below the blue boxes are your classes. Like example, under nutrition, you have ingestion, digestion, absorption, metabolism, and hydration. Okay? Another example, sexuality. Under that, you have sexual identity, sexual function, and reproduction. So these are all 47 classes. Okay? And under each classes, you have your nursing diagnosis. So that's how varied and that's how rich your nursing diagnosis taxonomy 2 is. Okay, now, after we were able to describe what a diagnostic label is, no? This diagnostic label, if you would notice on the listing on the back of your nurse's packet guide, there are qualifiers that were added to each NANDA nursing diagnosis that gives additional description of the client's problem. Okay, so you have there, like, say, elimination impaired. Okay, diarrhea. Okay, you have ineffective breathing pattern, impaired mobility. Okay, so these qualifiers can give or provide additional description of the problem. So when you say deficient, okay, it pertains to that there is inadequacy, insufficiency, or incompleteness in amount, quality, or degree. Okay, next you have impaired. When you say impaired, it was made worse, okay, maybe weakened, damaged, reduced, or deteriorated. Okay, then you have there decreased pertaining to a lesser in size, amount, or degree. Okay, then you have ineffective, meaning it is not producing its desired effect, or compromise, to make vulnerable to a threat. Okay, so these qualifiers are added to the diagnostic label to be able to describe them even further. Okay. Example, the bold or the bigger letters here is your diagnostic label called breathing pattern. Okay, so one diagnostic label is breathing pattern, which has a qualifier ineffective. So this may mean that the client's problem is that he is breathing, the patient is breathing. So when you say breathing, that's the process of inhalation, taking in of air and expelling air, exhalation. However, the patient, yes, he is breathing, but his breathing does not produce adequate ventilation. Okay? What does it mean? It does not produce the adequate ventilation. So how does breathing differs from ventilation, ma'am? Ventilation is the desired effect of breathing, okay, which is characterized by a normal ratio of oxygen and carbon dioxide exchange. Okay. So, ma'am, there is a possibility pala that if a patient is breathing, it doesn't equate to saying that the patient is taking in the enough amount of oxygen that he needs for that particular inhalation or exhalation. Yes. Okay? So, here, we were able to describe that the patient has ineffective breathing pattern. Okay. Now, let us talk about etiology. The etiology, okay, when we talk about, let's say, the etymology of a word, okay, it refers to how does the word started, okay, or where does the history of this particular fruit originated, okay? So when you say etiologies, these are your related or risk factors. Okay, so this part of the diagnosis answers the question, what contributes to the problem? However, this must be a condition that the nurse can treat. Again, medical diagnosis should never be used as an etiology. Okay, so to cite an example, the diagnostic label breathing pattern here has several related factors enumerated, such as, if you would look at the page for which the breathing pattern is located, the first part after the diagnostic label is defined, okay, it follows the enumeration of the possible related factors. Okay. Example. Example here you have neuromuscular dysfunction, spinal cord injury, neurological maturity, okay, musculoskeletal impairment, could be bony chest wall deformity, anxiety, pain, neurological damage, fatigue, respiratory muscle fatigue, body position, obesity, hyperventilation, okay, hypoventilation syndrome. Okay, so these are examples of usual related factors of the diagnostic label ineffective breathing pattern. Okay. Now, each problem or diagnostic label has a specific definition on it. If you would look at your nurse's pocket guide. Okay? So this would tell you, yeah, this is the correct diagnosis because this is the definition of this diagnostic label. Okay? Then you have related factors. These are your related factors. Okay? So you will be able to use any of this provided that these are or this is the applicable related factor based on your assessment of your patient. Okay. Now, if a patient is having difficulty in breathing because he has a lung condition called emphysema, okay? Emphysema is a lung condition that causes shortness of breath, kinakapos, because the air sacs in the alveoli are damaged. Okay? A patient who has emphysema may have hyperventilation or exhales more than he inhales. Okay? So this means his ineffective breathing pattern is because of hyperventilation. So we now write this as ineffective breathing pattern as your letter P for the template basic 3-part statement of your nursing diagnosis, followed by the word related to. The next underline is your etiology, which is hyperventilation. Okay, so as we write our nursing diagnosis as nurses, this way because hyperventilation can be treated by nurses by performing several nursing interventions alone, like position changes. Okay? So maybe the client is having difficulty of breathing because he is lying flat on bed. So we may raise the head of the bed. Okay? That is called what position? You have your Fowler's position that allows for maximum lung expansion compared when a patient is lying down. Okay? Or maybe breathe through a paper bag. Okay? So it is incorrect to state that ineffective breathing pattern related to emphysema because emphysema is a medical diagnosis which requires medical attention, which also includes prescriptions of medication and procedures that we as nurses can only perform with your doctor's order. Okay? So that is why we focus on your patient's response and those related factors that nurses can treat themselves, by themselves. Okay? So that's your etiology. And then you have your signs and symptoms. Signs and symptoms are your cluster of signs and symptoms exhibited by the client that indicate the presence of a particular diagnostic label. Okay, so these are clusters of signs and symptoms as I had said. So if to guide you in your defining characteristics for this particular diagnostic label breathing pattern, okay, you can open your nurse's pocket guide, okay, on the page on breathing pattern. And if you would look at the lower part, no, it already tells you what are your usual subjective data of the patient if you have this particular diagnostic label. Okay? And what are the usual objective data? So, you know what to expect if your client is having this problem. Okay? So, for breathing problem, the subjective is your feeling of breathlessness. Okay? What are your objective data? You have dyspnea, orthopnea, bradypnea, tachypnea, alterations in the depth of breathing, okay, maybe shallow breathing, okay, prolonged expiration pace, okay, you have pursed lip breathing, decrease minute ventilation, vital capacity, decrease inspiratory, expiratory pressure, the use of accessory muscles to breathe, the assumption of the 3-point position, okay, or your tripod position. You have altered chest excursion, okay, nasal flaring, so pag humihinga, lumalaki ang butas ng ilong, okay, and then you have increased anterior-posterior diameter of the chest. Okay, so these are your defining characteristic. By rule of thumb, there should be at least 3 defining characteristics present on your client's assessment data, the first column, for your nursing diagnosis to be correct, and this should be attached to your problem plus etiology plus your signs and symptoms. Okay, so at least there should be 3 of this objective data found on the first column of your nursing care plan, which is your assessment. Okay, so basically that's your 3-part statement on writing your nursing diagnosis: problem, etiology, and signs and symptoms. Okay, so overall, considering the components of your nursing diagnosis that we itemize each, so we follow this template for writing your nursing care plan. You start with that diagnostic label or the problem ineffective breathing pattern related to your etiology, which is hyperventilation, as evidenced by, okay, so we mentioned we use 3 defining characteristics when writing them. Shortness of breath, dyspnea, and use of accessory muscles for breathing. Okay, so this is how we write your nursing diagnosis. Okay, now, there are several guidelines in formulating nursing diagnosis so that you be guided. Okay, so that you would arrive at a correct nursing diagnosis statement. Okay. Person's response rather than nursing need should be your focus. Okay. Example. The red part here is the incorrect way or manner of writing, and those that are underlined is the correct way of stating your nursing diagnosis. Example. Needs suctioning because she has many secretion. Okay? Needs suctioning is a nursing need. Why? Because you perform this to your patient. Okay. So instead of writing this, you may write high risk for aspiration, okay, related to excessive oral secretion. So the client has a lot of secretions on his mouth. Now, if this patient has this kinds of condition, the secretions has a possibility to enter the airway. Okay. Basically by simply breathing. Okay. So it requires that you perform suctioning. So the need or the statement here needs suctioning or to perform suctioning should be part of your interventions, not a part of your nursing diagnosis. Okay. Use related to rather than due to or caused by. Example, altered sexuality patterns caused by changes in body structure. Instead, you write altered sexuality related to changes in body structure. Okay. Next, I mentioned this during our discussion. You write using legally advisable terms. Example, high risk for trauma related to inadequately maintained skin traction. So what's a skin traction? Okay. Example, a patient had a fracture. If a patient had a fracture, maybe not that fully disconnected, the bones were not that fully disconnected or not that fully crushed, I just need to maintain or de-align them. Okay, the patient may be placed on a skin traction and an orthobed. Okay, so if you would take a look here, there is bandage that is covering the lower leg of your patient. So that's having direct contact on the skin of your patient. Okay, and then it is being pulled here by a weight. Okay, so these weights maintain the alignment of the bones, okay, to facilitate healing or faster healing. So if you have these kinds of patients, since there is direct contact of a bandage for a prolonged period of time on the skin of the patient, then the patient's skin may be prone to infection or unimpaired in the integrity of the skin. Okay, but if you say that this is because you weren't able to properly maintain the skin traction, so it can be taken against you because this is your task as a nurse. Okay? So you may rewrite your nursing diagnosis as to high risk for trauma related to hazards of skin traction. So these are the things na the hazards for skin traction are something that may be brought about to the patient because of a particular intervention. But as nurses, since we say that we need to prevent the occurrence of a risk problem, that's why we are doing preventive measures. Okay, so that is the first few guidelines. Next, we proceed. Diagnosis without value judgment. So do not do this. Okay. Example, altered parenting related to poor bonding with the child. So it's like saying, or it's like blaming the parent for not having a proper parent-child relationship. Okay. Instead, altered parenting related to prolonged separation from a child is a better way of writing it. Okay. Avoid reversing the parts. Okay. So take note that when you write your nursing diagnosis, you start with the problem, not with the etiology. Okay. So here, confinement at home related to impaired social interaction. So the cause of the impaired social interaction is confinement at home. So that format should follow problem, impaired social interaction, plus your etiology, which is confinement at home. Okay, next. Avoid the signs and symptoms of illness in the first part of the statement. Okay, so here, etiology comes first, then is followed by the problem. Here, letter S, or the signs and symptoms, was first presented, followed by the problem. Okay, so withdrawn behavior related to the inability to engage in satisfying personal relationship. So instead, you say social isolation related to the inability to engage in satisfying personal relationship. Okay. And lastly, the two parts of the diagnosis should not mean the same thing. It's like your problem, you have written your problem and you state the related factor, which is the definition of the problem. Example, stress incontinence related to the inability to control urine. So this is wrong. Why? Because the definition of stress incontinence, okay, you can do IgM. So what do we mean when we say stress incontinence? It means the inability to control urine. Okay, so that is why you write what could be the possible cause why there is stress incontinence. Okay, it could be because there is already loss of muscle tone on the sphincter or the urinary sphincter. Okay, that's why when the client felt any urge to urinate, they just urinate and they can no longer control the act of urination. Okay, so these are your guidelines so that you may be able to properly and correctly write your nursing diagnosis. Okay, so do not forget our Nurse Marty memory tip number 4, PES. Nursing diagnosis is composed of the problem or your diagnostic label, the etiology, which is the cause, okay, and your signs and symptoms, which are your defining characteristics. Okay, so I think now you are ready to complete the nursing diagnosis column on your NCT template. Okay, so considering the case scenario that was given to you during our discussion after the assessment phase, you now write your nursing diagnosis following the template P plus E plus S. Okay, so see you next time when we discuss the planning phase and the intervention phase, and lastly, of course, the evaluation phase of the nursing process.